and get this all set up. Hopefully I transition this. All right, let's see here. All right, so let me just give you, hi everyone, just wanted to put a face to my voice really quick. So I'm super excited to be working with Keystone. I believe that Josh and Lucas are fabulous at what they do. I also learn a little bit more every time I work with them too. And I just want to point out how extremely important it is and what a big deal it is that Josh and Lucas bring in some more stuff. Like he said, Medicare is also really confusing, and it's really important to integrate that into the whole picture for planning your financial future. So just want to give them a little nod there, and I'm really happy to be able to work with their clients. You guys are all great, so very excited. So we'll go ahead and get started here. Alrighty, so just to introduce myself a little further, my name is Ryan Little. I am the founder of Eversure Insurance Strategies. We are a Medicare planning brokerage, and really what that means is I do nothing with insurance except for Medicare. I'm strictly Medicare, so it's a very confusing process, as some of you may know. If you're coming of that age, if you're at that age, or possibly you've helped a friend or a family member or a neighbor in this stage, because there's really no straightforward resource. You can't call Social Security or Medicare and really get a start to finish guidance, to enroll into Medicare. So that's where I step in. A little bit about myself is here. So we offer free, no obligation consultations. This is really important because everybody's situation is a little bit different. So I really take the time to make sure that we're looking at all aspects of your budget, your lifestyle, what you're looking to get out of Medicare plans. And I help you from start to finish, so from the quoting to enrolling, and then everything else after that. I really stay your point of contact for any questions or claims, issues, anything after that. I remind you when there are changes to Medicare throughout the year, and I think that's really important. Now, one thing I want to stress is that I am a broker. I'm not a captive agent, so I don't favor any particular insurance company. I contract with many of them available in Colorado, and we also work in a couple other states. So that gives me the power to give you more choices as far as what would fit your specific needs. If you work with a lot of Medicare agents these days, they are captive agents, meaning they represent only one company. And of course, they're gonna make it sound like that one plan is the best for everybody, and sometimes that may not be the case. So here's just a little snapshot. I'm sure everybody has heard all the Medicare lingo. It's kind of an alphabet soup, if you will, of all the parts that fit into Medicare. And it is daunting, and that's why I'm here again, to help you understand all the many choices when it comes to Medicare. Here's some common questions that are often brought up in consultations. If you're eligible, some people want to know if they're eligible if they have any kind of health conditions, also known as pre-existing conditions. Medicare has some really specific and strict guidelines and timeframes as to when or if somebody can enroll in any given plan. So it's really important to work with somebody that is on top of those timeframes and is knowledgeable on when and if you can enroll. What does guaranteed issue mean? Guaranteed issue is when somebody can enroll into any given plan without any kind of underwriting, meaning that your previous health conditions doesn't matter. So they're not gonna screen you, they're not gonna ask any health conditions. That means that you're going to be able to enroll into a plan. They're gonna accept you no matter what. Third question is, how much does Medicare cost? This really varies for everybody. So depending on how often you utilize the doctors or hospitals. This also plays into what plans you choose, and then your specific medications. If you have some prescription drugs, those specific drugs are going to impact your costs as well. Will my doctor take me when I change to Medicare? So it's really important to check with your doctor if you want to continue seeing your current doctor when you transition to Medicare. It's important to check with them to see if they will grandfather you in. Most of them do, since you are already a current patient of theirs. However, if you need help finding new doctors or new specialists, that's also a part of my service as well. I can search out. I can even get as specific as to, the radius around your home, so you don't have to travel very far, whether you or not you like a male versus female doctor, and so on and so forth. Should I go on my employer's retirement plan or Medicare? This is a question I get often when somebody is age 65 or older and they're still working, which is the case a lot these days. So a lot of employers offer retirement plans that are as good as Medicare, but often that employer has possibly contracted or made an agreement with a certain plan. And, while the plan it might be great for a lot of people, again, it's only giving that employee, yourself, one choice. So it's important to really look at all the different choices out there before you just hop onto an employer retirement plan. So there's some options, again, that we can look at. Will I be covered for foreign travel? So this highly depends on your plan. Some plans offer some foreign travel coverage in case of emergencies that offers some acute care, and some plans do not. So it's important that we discuss that in your consultation. So Medicare Basics for this year, these numbers change every year. So once I go through the costs and stuff, just keep in mind everything changes, kind of like Lucas was saying that, rules for Social Security changes every year. Same thing goes with Medicare. So let's just go through some of the basics with Medicare. You hear the term Part A. This means it's your hospital care. And there's really no cost for most people that have worked at least 40 quarters of Medicare covered employment, and you paid into your Medicare taxes. Part B is your medical care. The base monthly premium for everybody could vary from $109 to $134. And the reason this varies is whether or not you're drawing Social Security benefits yet or not. And approximately 5% of everybody on Medicare will have to pay an income-related surcharge. So what they do is they go back 2 years and look at your tax returns, and depending on your income, they will charge you an additional surcharge to that base Part B monthly premium. This is billed by Social Security. So if you are a person who is drawing Social Security benefits at this time, they will automatically take your Part B premium, the 109 or the 1 to 134, out of your benefit check. If you are not currently drawing Social Security benefits at this time, they will send you a quarterly bill, so you can just send in the check for that. So when you're turning 65, this is when you want to sign up for your Part A or Part B, or if you are past the age of 65 and coming off a group employer plan. And here's your time frame. It's pretty easy to sign up for A and B on socialsecurity.gov, or you can visit your local Social Security office, and it's usually just one form to enroll. And that's what I mentioned about if over 65, you need to sign up within 6 months of coming off of that group employer plan. And again, I'm talking about those time frames that they're pretty strict on as far as when you cannot enroll in certain things. So beyond A and B, you have to have A and B before you enroll into what they call a Medicare Advantage plan or a Medicare Supplement plan. Here are the original costs for original Medicare costs for this year. And again, these numbers vary a little bit every year. So if a person were to enroll in what you hear termed as original Medicare, and this is the only thing they enrolled in, this is what it would look like. Your Part A hospital care, the deductible per occurrence is $1,316. So this means that every time you get admitted into the hospital, you're paying upfront a $1,300 deductible when you go into the hospital. These are the copays, depending on how many days you're in the hospital. So if you're past day 60 in the hospital, these are per day copays on top of that deductible per occurrence. So that can add up if you're in the hospital for quite a while. Skilled nursing, this only kicks in if you're admitted into the hospital for at least 3 days. And those copays are as follows there. If you're past day 20, then that is also a per day copay. Now on to Medicare Part B. So this is your medical care and your doctor visits. This has an annual deductible of $183 this year. Medicare generally pays approximately 80% of medically covered claims under Part A and Part B. So that leaves about 20% that falls on the responsibility of you. So if you're a person that just had original Medicare, Part A and Part B, if you went into the doctor or hospital for any reason, you would be subject to these copays and deductibles, but then on top of that, any of these, this additional 20%. So the goal here is to help minimize the out-of-pocket costs, because depending on what's going on with you, these costs could be pretty darn large. So let's move on and see what you would do to minimize these costs. So this is what your Medicare card looks like. Most everybody has seen this. It's the fancy-dancy red, white, and blue Medicare card. It will show when it is effective. It usually becomes effective for your Part A and Part B the month of your 65th birthday, okay? Or the dates might differ if you are past the age of 65 and also, coming off a group employer plan, like I mentioned before. So the first choice to minimize your out-of-pocket costs associated with Parts A and Part B is to enroll into what they call a Part C or Advantage plan. And we'll go through the differences in just a second. The other route you can go is to enroll into a Medicare Supplement plan. So let's go through the differences here. So Part C or Advantage plans, these become your primary insurance, the plan carrier. These are really attractive plans because they often have a very low or a zero monthly premium. Drug coverage, your prescription drug coverage is often included in these plans. They also have possible additional benefits, dental, vision, health club access. Some of you may have heard of Silver Sneakers, so they offer some free membership to some of the health clubs around the area. So that's actually a really great perk. Guaranteed issue, there's no health questions with these plans. So when you are first eligible for Medicare and you enroll into a Medicare Advantage plan, they accept anybody. There's no pre-existing conditions. These are usually HMO or PPO networks, meaning that you have to see doctors in those networks. Changes and cancellations to these plans are only during certain times of the year. So everybody's heard of Medicare open enrollment, and that happens October 15th through December 7th of every year. So that is the only time you can make any changes or cancel these plans. These plans have copays and deductibles associated with most everything with these services. Now, they cap those copays and deductibles. So if somebody is having some health concerns in a year and they're bouncing in and out of the doctor or hospital, Medicare automatically caps those out-of-pocket costs. So even though these plans have a low or zero monthly premium, there are copays and deductibles associated with them. So that cap for 2017 is $6,700. So that means that in any given calendar year, you could be out of pocket up to $6,700, depending on the plan, when you're bouncing in and out of the doctor or hospital. So even though the monthly premium looks really great, the out-of-pocket costs, behind the scenes can really add up. You must abide by their formulary for drug coverage. So for every plan has what they call a formulary. So if your specific drug or medication is not on their list of covered medications, then you will be responsible for the full retail cost of that medication. Now, their formularies are pretty extensive, so there's usually, nothing to worry about there. But if you are on some kind of specialty drug or some of the more expensive drugs, it's possible that they are not going to be on those formularies. Now, one more point I want to make with these that sometimes is kind of troubling for doctors or patients is that doctors often must seek approval from the actual insurance company for certain services. So, for example, if Lucas was on Medicare in one of these Advantage plans and he had a bad accident and needed to go in for an MRI, the doctor would possibly have to call that Advantage plan company and say, Lucas was in an accident, I would like to do an MRI. The company would come back and say, well, Mr. Doctor, let's keep some costs down, and why don't you try this, this, and this before we go to that MRI. Now, I understand managing costs, and that's great, but some doctors feel it's kind of overstepping, and, it could be a little bit difficult for patients as well. So let's move on to what Medicare Supplements and Medigap, also known as Medigap plans are. So with these plans, your primary insurance stays Medicare, and then your supplement becomes a secondary insurance. All of these plans are standardized, and what that means is that all of these letters here, depending on what plan you choose, if you were to enroll in, say, a Plan F, then every Plan F, no matter what company you go with, has the identical coverage. So it's really down to cost because all companies charge different premiums for the same exact F plan. Now, with Medicare Supplements, there are no networks, so you can see any provider in the U.S. that accepts Medicare, and most of them do. Foreign travel emergency is covered with some plans. Again, this is something that we would need to discuss if it was, part of your needs. We would need to go over that in a consultation. There are no referrals required to see specialists on these plans. So if you needed to go see, an internal specialist or something of that nature, as long as they accept Medicare, you can go right to them. You don't have to get a referral from a primary care doctor. No approvals needed for services. So like I discussed before with Lucas's example of his accident, if you went in and a doctor said, I'd like to do an MRI, he could do that without calling the insurance company to get approval for that. These do have monthly premiums. Now, even though they do have a higher monthly premium than the previous Advantage plan or Part C plan, this gives you the ability to plan your annual budget because what you pay for your monthly premium is inclusive of any copays and deductibles. So really you don't have any copays or deductibles beyond your monthly premium for these plans. So it really gives you a good idea of what you're going to be paying for your health care for that year. You must purchase a standalone Part D plan for drug coverage when you enroll into a Medicare supplement plan. Now, the great thing about this is that we can plug all your specific medications into our system, and I can look at all the plans available in your area and tell you what your most cost-effective Part D plan is for that year. And you know, that can change every year. Every plan changes a little bit every year, and people's medications change every year. So it's really important to review this on an annual basis, and that's another thing that I send out a little reminder when it's about to become Medicare open enrollment season, so we can review your medications and make sure that you're on the most cost-effective plan moving forward into the next year. This has a seamless claims process, so there's no balance billing from the doctor's office. So how it works is when you go to the doctor or hospital, that doctor or hospital will bill Medicare, send the claim directly to Medicare. Medicare Part A and B pays their portions of it, and then Medicare electronically sends it over to your Medicare Supplement company. And the Medicare Supplement company pays the rest, depending on what plan you do have with them. So it's really, really simple. You don't, pay copays and deductibles generally, depending on what plan you have. So it's really a simple claims process. All you get at the end is a statement from Medicare saying that, this is what you got done. Pretty easy. You can change these plans anytime when you qualify. Now, what that means is Medicare supplements do not have to follow some Medicare guides as far as open enrollment. So you can change Medicare supplement companies at any time during the year as long as you can pass their medical underwriting if it is outside those guaranteed issue windows. Now, I know that sounds a little bit confusing, and that is something that we can kind of explain a little more in depth in a consultation. And for the sake of time, I'm kind of just touching the basics of all this stuff. And again, you can contact me or reach out to Lucas if you have some additional questions, and we can kind of look at everything for you specifically. Now, Part D prescription drug coverage. When you enroll into Medicare Parts A and B, Medicare says that you must have some form of drug coverage, or you could be subject later to a 1% penalty for every month you did not have coverage. So what this means is, say Lucas was Medicare age and he enrolled into Medicare Parts A and B, but he's not really taking any medications at this time, so he decided that he doesn't really need a Part D plan right now. So a few years go by and he decides that he's getting some, prescriptions from the doctor that he needs to start taking some medications. Now, since he did not enroll when he was first eligible, when he got A and B, he is now subject to a penalty of 1% for every month that went by that he did not have Part D coverage that he was eligible. And that 1% is based on the average cost for a drug plan in that given year. This year, the average cost for a Part D drug plan is $34. So, if he went 20 months without that coverage, then he's subject to 20% penalty on top of his normal Part D premium. And that penalty lasts for the rest of your life. So this is really, really, really important to realize up front. If you are somebody that does not take medications and you're enrolling into Medicare, I always recommend that you go ahead and enroll into a prescription drug plan, and we just put you on the least expensive drug plan for your state, just to avoid paying this penalty down the line. Some of this coverage is included in Advantage plans, but you must abide by their formulary or list of covered medications. If you have original Medicare and a supplement, you may enroll into any standalone Part D plan, and again, we can load your medications into the system and tailor your coverage accordingly and make sure that you're on the most cost-effective plan. Everybody's probably heard of the donut hole or the coverage gap, And this does not come into play for most clients I work with. So it's not something that everybody has to worry about. It's usually just for people who have some higher retail cost medications. And again, that is something that we can sit down individually and discuss if that is something that will come into play for you. Now, beyond Medicare, there's some health-related expenses that are not covered by Medicare. And sometimes this comes as a surprise for people. So this is just a little snapshot, just a little reminder that Medicare does not cover everything health-related. These include some dental, vision, and hearing coverages, short-term, long-term care, life insurance, and final expense insurance. So just to keep that in the back of your head, between Keystone and myself, we can direct you to some additional resources for this coverage too. So I hope I didn't go too fast. Again, in the essence of time and respecting everybody's time, I appreciate you being on here today. But I just really skimmed over some stuff. So here's my contact information, my website, my office number, and my email. So feel free to reach out for any of these. And you can also get a hold of Lucas or Josh if you have any questions or if you'd like to set up a free consultation. And with that, I will get Lucas back on.
Yep, perfect. Thanks, Ryan. We definitely appreciate you joining and being a resource for our clients and everyone in attendance today. I know Ryan and my schedule right now, we kind of left room to answer any questions. I know we went a little bit over the expected time frame, but if you guys have time and have questions that you want to ask either of us on these topics, we'll stick around and make sure those get answered as best as possible. Obviously, if it's more personal and a complicated scenario, then that would probably require kind of offline conversation, but we'll definitely make sure you get contacted with either Ryan or myself to make sure that you guys are taken care of. Again, we like doing these types of events just as a resource for not only our clients, but their friends and family. And so if you know of anyone else that would value from this type of content, we'll definitely have the recorded versions online on our YouTube channel for you to share with them. Then also, yeah, just passing along our contact information. We're really hands-off. We're probably the least salesy type people that you would ever talk to in like the insurance and financial planning industry. So the most you'll get from us is just a follow-up, making sure that there's no follow-up questions, that we provided enough value and how we can improve moving forward. So those are typically the follow-up conversations we'll have with you if you're not a current client, or if you are a current client and you're want to share some of this information with a friend or a loved one, then that's kind of the approach that we always take. And we know it's important to you that we're not pestering or being a nuisance. So feel free to shoot over any questions for Ryan or myself, and we'll make sure that we stick around to answer those for you guys. We'll give you guys a couple seconds, and again, I'll pull up just a couple more seconds to see if anyone's interested. I see people kind of probably heading back to the work day here, but anything else that comes across either now or down the line, always use us as a resource. Again, complimentary consultation on Medicare or the Social Security analysis. Yep, and thank you, George, for joining us. Definitely a great time. We'll continue to do more events like this. We'll continue to shift the topic and shift the dynamic of how these webinars are held, as well as the physical presentations that we do in the future. So thank you, everyone, for joining us. We're going to close up this, and we look forward to hearing from you guys in the future.